Good morning, everyone. Thank you so much for joining today. We're here to talk about the Opargo and Allscripts solution. I'm Nancy Harvey with Opargo. We're looking forward to showing each one of you the tools that are available to run your practice based upon data and not upon emotion. Our call is going to be recorded today, and if you have any questions that you'd like to submit, please use the WebEx chat feature. A special thanks to Dr. Peter Forman with Delmar Family Medicine and Mary Kay Martin from ENT Associates of Texas for their commitment to the Allscripts and Opargo products, as well as agreeing to share some of their time today and teach us about what they've been able to do in their practices leveraging Opargo. We're going to kick things off with Opargo's co-founder and CEO, Paul Wiley. Paul, why don't you tell us about how all this got started?
Great. Thanks, Nancy. Appreciate it. Really good to be here with everyone, and thanks also for your time. So just a little bit of background about Opargo before we let our friends share a bit more detail of how they've seen it. But really, if you think about from an Opargo perspective, I started it with my co-founder, who's a pain management physician, and he had really two big problems. First is the patients who needed care the most were going elsewhere because he had a long wait time for them to get in. And then secondarily, his revenue was declining significantly over the prior few years. So my background's not from healthcare. I actually ran the corporate division of Sabre and United Airlines before this. And so the thought was, can we apply the same optimization principles from the airline industry into healthcare at time of scheduling? And if you think about it, from an airline perspective, there's a set number of seats on a plane. In general, more passengers want to get on that plane than possible, and a business traveler will pay more for that seat than a family of four. From a healthcare perspective, there's a set number of visits in a day. In general, more patients want to get in than possible, and each visit has a differing medical need and urgency, as well as a differing value to the practice. So we said, hey, is there an opportunity for us to apply this logic? And the answer is an overwhelming yes. So what do we do, and how does Opargo work? Well, what we do, a patent-pending solution that automates these recommendations based on what's most important to the provider and the practice. So we look at things like medical need, as I mentioned, look at things like referral source and utilization of providers to make sure that these practices, your practices, are running as efficiently as possible, while also ensuring that patients receive the best medical care possible. And one of the important things that I always reiterate is we make sure that all patients get in. We believe it's wrong to deny care, but instead we make sure that those patients who need care the most are the ones who get in as soon as possible. So what do we do, and what is this? How does it work? So we make sure providers are the right kind of busy by using data to reduce empty slots, reduce no-shows, reduce cancellations. We make sure those high-need patients don't go elsewhere for care, and then increase the utilization across the providers. And the great part from this partnership with Allscripts is it's fully integrated within APM. And so in that regard, all your patient engagement remains. Billing processes remain intact. Clinical workflows are not interrupted at all. And so it's really a seamless process for you and your schedulers. And I'm excited to now turn it over to Nancy, who's going to talk through a little bit more of the process and share some more detail.
Thanks, Paul. So every Opargo process starts here with an evaluation and consultation. You're learning about what Opargo can bring to the table, and then we obviously learn about your practice and what your needs are. We typically then roll pretty quickly over into the Optimization Readiness Consulting Project, where we really start to begin to understand your data. So let's dig further into that Optimization Readiness Consulting Project and give a better understanding of what it brings to your practice. So we're going to capture 12 to 24 months of data. Think about that data as the second that the patient requests the appointment, how long was it between the request of that appointment and when the appointment was actually held, how was that patient referred, who in your practice saw that visit, what was the duration, what did we call it, was it new, established, etc., and then what CPTs were billed, and then how did different insurance carriers reimburse for the exact same things. So then we take that span of data, slice and dice it into 40 key efficiency metrics and come back to you and say, okay, this is how long patients are waiting to receive an appointment that are new patients. Here's where we're seeing some trends around when no-shows, cancellations, and last-minute reschedules are happening. We're also taking a look at your providers and how well they're being utilized, where your valuable referrals are coming from, and then also better understanding true demand so that we know if your templates are in line with what patients are actually being promoted in your practice. So Paul and I actually met Dr. Forman, our first speaker today, at one of the Allscripts user groups. And in initial conversation, it became clear very quickly that he was definitely interested in having the optimization readiness analysis done for his practice. So thank you, Dr. Forman, for being here today. Dr. Forman is the owner of Delmar Family Medicine, and he was a resident at the Albany Medical Center and is now their medical director over their physician assistant program. He also attended Ross University School of Medicine and is a member of the Allscripts Clinical Advisory Board. Thanks for that, Dr. Forman. I mean, certainly having your type of input in that is very helpful. Delmar Family Medicine is an independent, patient-centered medical home and a CPC Plus practice that was founded in 2007 in Delmar, New York. And they've been using Allscripts for about 8 years, have 2 physicians and 2 nurse practitioners. Dr. Forman is going to share with everyone today his experience with the Opargo Optimization Readiness Engagement. And we'll be taking a look at some of the details of his analysis and how it helps Delmar better understand how patients were changing their appointments, some scheduling behaviors, actual provider demand, and provider benchmarking. So Dr. Forman, thank you very much for joining us, and we look forward to you stepping through some of these findings and how they benefited your practice.
Sorry, I was muted. Hi, how are you? Just a little bit of background so that people can kind of understand where I was coming from with this. I left a large multi-specialty group about 12 years ago to start my own practice because patient access was really important to me. I was running into people in the community and they were telling me that they couldn't get in to see me for 6 weeks, and I didn't understand how that was possible since I was in the office every day. So access was super important to me, and from the time that we opened the practice 12 years ago, we wanted to make sure we had same-day appointments for all of our established patients, regardless of what the complaint was. We started with 1 provider, one front desk person, and 1 nurse, and now we're 4 providers, 4 LPNs, and a part-time RN, 4 front desk people. And our schedules were full, and I wanted to make sure that we were doing things the right way. We were seeing areas where, we were getting complaints from patients that they couldn't get in a timely manner. So when I ran into Paul and Nancy and they started telling me about what Opargo did, I was definitely interested in kind of getting that information. So one of the things that came, do you want me to talk about the data, or do you want to?
Yeah, absolutely.
Okay, so so we kind of signed up to do the readiness evaluation and optimization, and some of the things that came back to me that were interesting. We do confirmation calls by human, so I realize that's old-fashioned and probably not the most efficient way to do things, but so we were doing confirmation calls the day before. And one of the things that came out of this optimization is that a lot of our changes in schedule, either cancellations, moving of appointments, or things like that, happened either same day or 1 day before. You can see from that pie chart that 48% of our changes to our schedule were happening 1 day before. So one of the things that came out of that is, well, what if we did the confirmation calls 48 hours in advance instead of 24? We would get a little bit more flexibility with changes, and so that was one thing that we did, and we have seen an improvement in ability to have more appointments and fill those appointments the same day. and also learning, which spots were high likelihood for cancellation and no-shows. And it was interesting. One of the things that I kind of knew was it always seemed to me that Wednesdays were our kind of least busy day, and that kind of came out in the data. I don't know if that's in one of those screens or whatever. But one of the other things was that it seemed that the appointment times right around lunchtime, either last appointment of the morning session or first appointment of the afternoon session, were the ones that were most likely to be canceled. So we made some changes in the types of appointments that we put in those slots. This, how far in advance appointment schedule? So this was telling us how far in advance our most of our appointments were scheduled, and this allowed us to kind of make some changes in exactly how many physical exam, annual wellness visits, and things like that we schedule in a day to kind of make more urgent or problem visits available.
Yeah, absolutely.
And then they did some schedule template analysis and allowed us to make some adjustments to schedules for improving access. And then I think it's the next slide.
Yep.
So this was kind of the eye-opening thing for me. They did staffing benchmarking, and we were a 2 MD, 2 NP practice. And there were some revenue things and some issues but when you're standing in the middle of the hallway, everybody looks busy all the time. So getting this actual hard data and realizing that one of my nurse practitioners, that the 2 nurse practitioners were not being utilized as well as they could be, and that one of my nurse practitioners was literally at a quarter of what her utilization should be. I actually did make a decision from this data, and we are eliminating a nurse practitioner and going to a 2-doc, 1 nurse practitioner practice to improve our overall financial efficiency. My guess is that 6 to 8 months down the line, we'll probably need to ramp up again, but I think we'll be in a better position to do that, and we'll be able to do that with kind of more efficiency from the data that we've learned from this process.
Awesome. Did you have something you wanted to say, Paul? Nope. Okay, well, I definitely appreciate your input there, and we'll dig a little bit deeper into then how we take these optimization readiness findings and then utilize them to actually schedule appointments for your organization, because we use that data as a guide to implementing Opargo. So Opargo is actually a tool that your scheduling staff will use to schedule an appointment. And, the way that a lot of people schedule appointments now is what we call a look and book type environment, where you're going into Allscripts, you're looking for the appointment that's available, and then you're deciding which one of those available time slots you think that patient should go in. Well, we believe that we can do it better, because we have an opportunity to strategically understand how that availability should be used. Paul talked earlier about how the airlines hold seats on a plane knowing that certain travelers are going to come. We're going to do the same thing. So how does Opargo know how and where to schedule appointments? Well, first, we use all of that data that we gleaned during the optimization readiness engagement. And then we have 3 engines that slice and dice that data. So the optimization engine is the one that prioritizes patients' visits for those who need it the most. It can help your surgical conversion rates. It can push patients that need appointments for additional ancillaries when appropriate. We can also make sure that patients that are referred by certain referring providers receive priority appointments. The rules engine can load balance patients across resources that are available to see those types of patients. make sure that we're never scheduling something at a location where it shouldn't be scheduled, and then also is never going to allow a patient to be scheduled with a provider that does not accept that insurance. Dynamic messaging is a tool that communicates with your scheduling staff with different tips as we schedule. So for instance, if you have a procedure maybe that can only be done every 30 days or insurance isn't going to pay for it, Opargo is going to keep track of when the last time was that visit was scheduled and warn the scheduler if they're scheduling it too soon. Maybe a patient has a pacemaker and so they shouldn't be scheduled for surgery at the surgery center and they should go to the hospital. We can make sure that there's visual indicators while they're scheduling to make sure that those rules and preferences are adhered to. So we take all of that data, understand the system's goals, analyze your scheduling templates, understand your network preferences, couple that with the patient's need, and then put all of that into the Opargo Optimization engine. It then goes out there, grabs available times in Allscripts, and presents the available times that best meet your practice's goals and this patient's need, like this beautiful gift on the right-hand side of the page. So I wanted to show you guys the best fit page in Opargo. It's appropriately named because it is prioritizing the best appointments that fit your practice's goals and this patient's needs at the top of the page. Mary Kay Martin with ENT Associates of Texas is going to talk to us a good bit about how she uses this to drive patients, making it to the right times with the right providers in her practice. But the ultimate goal is to make it easy for the schedulers to say, if I schedule one of these top 5 appointments, no one's going to yell at me. It's promoting the provider's preferences, and it's making sure that all of those rules are taken into consideration every time we schedule an appointment. So in effort to make sure that Mary Kay has enough time to talk with us about her journey today, we're going to offer deep dive one-on-one presentations so that we can meet with you at a later date, understand your practice, and show you guys Opargo from start to finish. And so let's talk a little bit then about sweet Mary Kay Martin, who's agreed to join us today. She's with ENT Associates of Texas, like I said before. She's been their administrator for the last 15 years. She actually opened the doors of the practice with Dr. Mahendale. They have 5 surgeons and 1 PA with 3 office locations with plans for additional growth. They're in an area in the Dallas-Fort Worth area that's just busy as all get out. The practice has used Allscripts since they opened their doors, and then in 2016 transitioned to Allscripts hosted platform. And their services span the full spectrum of ENT needs from head and neck surgery to balloon sinuplasty. When Mary Kay and I first sat down and visited, we uncovered that their practice has the best problem that you can imagine. They have more patients than they can accommodate. And man, oh man, that just gives Opargo the ability to really prioritize patients who need care the most, because if you have excess patient demand and patients might walk away, we want to make sure that patients who need care the most receive the soonest appointments. We were able to decrease the time that it took for new patients to receive appointments and give schedulers the tools that they needed to be successful. So Mary Kay, thanks again for joining us today, and I can't wait for everyone to hear about your Opargo story, journey, and how that's benefited your practice.
Well, good morning, Nancy, and good morning, everyone. As Nancy said, prior to Opargo, full schedules were never a problem for us. Our doctors were seeing approximately 26 to 30 patients per doctor per day. Most of those appointments were forced into non-existing slots or put onto a time slot where another appointment type had actually been assigned per our previous Allscripts templates. Appointments were given for non-urgent needs, but in the end, the staff was just trying to keep our patients happy. Great customer service is always what we preach, and it's what we want after all. But realistically, what we were doing were we were training our patients and not our staff. Training them that they can call and they can get whatever they want if they push hard enough. Scheduling is not an easy job. As the screen on the first said, it's run by emotion 90% of the time. Opargo helps us with that. After Opargo, as you can tell by this screen, our monthly revenue has been on the rise ever since. March doesn't look so hot. We actually decreased a little in March because I had 4 doctors on spring break, and we're trying to run clinic with the poor one remaining doctor and 1 PA. But we've been going in the right direction. We've prioritized the types of patients that we see on the daily schedule. Optimal scheduling on higher value visits by a mix of payer types and more complex visits Opargo has assigned a higher acuity value to, and they return a more profitable day for our physicians and for our practice. Moving on to the next slide, we see the patient wait time by appointments. We've been challenged for a while, as Nancy said, we have more patient demand than we can actually accommodate, and it is a fabulous problem to have. But in an effort to maximize our resources to the fullest, we worked on defining our appointment types and developing templates that would steer what we call our fluff appointments, which are annual earwax patients, pre- and post-op appointments, to our physician assistant. What this did was then free up time in the schedule for physicians to see more of their new patient consults and more surgical patients. Prioritizing by appointment visit types and by referring doctors, we've been able to schedule those patients in a more favorable time frame, and it keeps our referral sources happy. As you can see on the graph here, we actually decreased our new patient appointments by 4 days, and we increased our routine follow-ups by 7 days. Now, as a specialist, I think a follow-up patient, non-urgent patient getting in 7 days is still not bad turnaround for that follow-up appointment. And the 4 days is fantastic for a new patient, so it's a win-win situation for us. Slide 3 is talking about our average revenue per visit. And this is where the buck stops, or where the bucks are actually earned, I guess I should say. This is the screen that impressed my physicians the most when we looked at this. Before Opargo, we would sometimes see, as I said, up to 30 patients per day per doctor. And that was doctors running up and down the hall with their coats on fire, didn't have time to do anything. Now we're seeing really 22 to 24 on a busy day. It's not unusual to walk down the halls now, instead of coats on fire, I can see a doc sitting at his desk charting during clinic hours, or maybe even with his heels up on his desk. They have time during the day to do the things that they want to do, so they don't have to work at night. The system does work, but you must train your staff to trust Opargo. This is the thing that we found out to be most paramount in this whole process. And what we've also discovered is this starts at the top. Physicians and management must buy in at 100% in order to return reports as we've seen here. We have to believe in the system, and it's returning the optimal appointment, but it might not always be the most convenient appointment for the patient. Opargo, as Nancy showed you on the first screen there, where it was returning the optimal appointments, they say the first 5 and thrive works. You need to train the staff to politely offer what's available and then stop talking. Most often or not, the appointment that is offered is the appointment that's booked, and it's the appointment that the practice wants the patient to have, not what the patient wants to schedule necessarily. I guess in closing, what I would like to say is that we started optimization, I believe, about October, and we went live in January, and the process was eye-opening, to say the least. In closing, again, I'd like to say the road hasn't always been easy, especially when we got to go live, and that has been mostly in retraining the staff to the concept of what the patient needs based on practice choices and not always what the patient wants. And this happens over time. It doesn't happen all at once. And to be honest, we still struggle a little bit of this some of the time. We still don't have 100% Opargo adoption for our staff scheduling, but as you can see from our reports, we certainly are moving in the right direction. I'm extremely excited about where we will end up once we can get full adoption and see where our numbers will go. I would really recommend and suggest that anyone who's looking to be more organized and practical in their scheduling needs for optimizing patients in revenue to give Opargo a look. I don't think anyone would be disappointed in what it comes back with.
Wonderful. Thank you so much, Mary Kay. I appreciate it.
Hey, I'd like to just follow up with what Mary Kay just said. I'm sorry, this is Pete Forman again. For anybody who's out there thinking about this, the optimization part of it for us was amazing, and the data that was returned to us was amazing. The other thing that I will say is Opargo, very honestly at the end of the discussion of our optimization said to me at this point, moving forward with the next phase and in the next application wouldn't be beneficial to you. So they were really upfront and honest in saying, yeah, we could certainly sell you our services, but for right now where you're at, you're kind of schedule optimized with a few tweaks here and there. So the data that we got back from the optimization was super, super valuable. I think that what they do, with the next part with scheduling and everything is really valuable to certain practices. Certainly, when there's, I'm a family practice, so it's kind of a little bit of everything, but there's not the surgical follow-ups and the different procedure appointments that make as much difference to a specialty practice, and I can see where the value for the ENT practice is there, but I just really wanted to kind of throw that out there. Sorry, I didn't mean to interrupt.
Oh, that's great. Thank you for the additional input. We appreciate it. We're very happy to be able to talk to you guys with true proof statements from customers that are using Opargo, and just really want to summarize some of these benefits as they've so eloquently stated. If we're not going to make room for patients who need care the most, prioritizing a patient visit doesn't matter. So holding the slots on the schedule for patients who need care the most, and then have the ability to take advantage of the majority of your ancillaries is what has been incrementally driving revenue, particularly in Mary Kay's practice. And so by making sure that the right providers are seeing the right patients, and if we think back to Mary Kay's earwax example, because their PA is doing the earwax patients, that means their doctor isn't. So what does that mean their doctor's doing? Waiting for the next surgical candidate to arise. Because of that excess demand, the number of patients that they have calling in needing tonsils and adenoids on the regular, we were making sure that the providers were able to see those patients and make sure that the PA was seeing the patients that were in line with the practice's goals. And like Dr. Forman said, we're really going to use the data to go back and understand when are no-shows happening and when are we seeing last-minute changes, whether that's a cancel or a reschedule. If you've got a last-minute reschedule, that's almost as detrimental to your day as a last-minute cancellation, because if you don't have the demand to backfill that appointment, you could be left holding available appointment times. So what we do is we use that data to identify trends over all of this patient data over the last 12 to 24 months to say, okay, let's plan for some of these things. Why not use the data to plan on what we can do from a move-forward basis to mitigate some of those last-minute changes. We can also automatically distribute patients amongst the providers in your organization that can see them. A lot of practices struggle with one provider looking at their schedule and then comparing their schedule to somebody else's, and then come to the administrator and say, why is it that I've got all the garbage on my schedule and she's got all the good stuff? Practices either really struggle with that or they don't struggle at all. If that's something that you need help with, man, oh man, we've got some good solutions for you. And then helping the schedulers manage the individual provider rules, like Mary Kay said, top 5 and thrive. If we've configured the tool appropriately, schedulers should, we joke around, be able to schedule with 100% accuracy, because Opargo is going to present the visits that are best in line with the practice's goals at the top of the page. And guess what? We're going to track the choice number. Did they pick choice number 1 to schedule that patient in, or did they pick choice number 150? Because we're going to find an appointment time that works for that patient, But let's find one that's also in line with the practice's goals. You know, Mary Kay talked a lot about advocating for the practice also. It's a balancing act of not over-advocating for the patient. And I loved, Mary Kay, what you said about you've trained the patients and not your staff. That's amazing, and I absolutely will be talking about that from this point forward. So hopefully you're okay with me using that in every one of my presentations till the rest of the time. But then it also gives us the ability to hold our schedulers accountable. You know, our billers are held accountable through their days in AR and what their collections look like. Our providers are held hugely accountable by many different organizations. Why is it that we've looked at our scheduling and said, you know what, it's fine? I would challenge you to say, how do you know that it's fine? Let us use that data. Let us help you understand how long are patients really waiting to get a new patient appointment. I can't tell you how many times practices have said, oh yeah, we get everybody in same day, next day. Well, guess what? You get them in on average of 7 days because that's what your data says. So from a next step standpoint, let us look at your data. Allscripts has done an amazing job of making this process very easy. We can get connected with your Allscripts sales rep, put the contracts together that are appropriate. It's completely separate. The Optimization Readiness contract is a completely separate contract than the Opargo Clinic Optimization because we wanted to give you the ability to analyze the data and with all of that data in front of your face, be able to make a decision on whether or not it really makes sense to move forward into using Opargo in your organization. So let's get that data pulled, and we can send some follow-up emails with you guys so that it'll make it easy to know who to contact and how to make that happen. And once again, thank you so much to Dr. Forman and Mary Kay for their time and input and collaboration. We really appreciate everyone who's joined today, and we welcome the opportunity to talk to you all about how you can use Opargo to make your practice the right kind of busy.